Hello and welcome to this learning module. In this segment, we will discuss various specialty care roles that EMTs and paramedics can serve in that go beyond working in a 911 EMS system. This video is intended to supplement any readings or coursework assigned by your instructor. The objectives for this learning module are, number 1, in addition to working on an ambulance, list different areas where EMS providers may be employed. Number 2, discuss specialized roles that EMS providers can train for. And number 3, differentiate 911 transports from inter-facility transports. Mobil Integrated Health, or MIH, is a rapidly evolving healthcare model that utilizes pre-hospital care providers to make non-emergent healthcare visits to individuals in their homes. MIH visits can include preventative care, chronic disease care, post-discharge follow-up care, and targeted care for specific medical conditions such as drug and alcohol addiction. The individuals who provide this care are often referred to as community EMTs and paramedics. Some regions have 911 telecommunicators who are trained to screen calls for aid and, when appropriate, will dispatch a community EMT or paramedic rather than an ambulance. The goal of Mobil Integrated Healthcare is to evaluate and, whenever possible, treat the patient in their home, which lessens the burden on 911 and emergency department resources. This helps minimize the cost to patients and the healthcare system while allowing patients to receive preventative and/or urgent care in their homes. In addition to reducing overcrowding in emergency departments and allowing 911 resources to remain available for emergency response, managing patients in their home reduces their exposure to COVID, the flu, and other communicable diseases that are prevalent in healthcare facilities. An example of preventative care includes regular visits to older patients who have diabetes and have difficulty maintaining control over their blood sugar levels. The community provider can evaluate their situation and collaborate with other healthcare resources to ensure medication compliance and to help the patient achieve better glycemic control. An example of chronic disease care is patients with congestive heart failure who can benefit from a community provider that can evaluate their electrocardiogram or ECG for irregularities, evaluate the patient for fluid retention or signs of worsening condition, and collaborate with medical control to adjust medication doses when appropriate. When a patient is discharged from the hospital, the emergency department, or a rehab facility, regular visits from a Mobil Integrated Health provider can enable the patient to be monitored and cared for to prevent readmission and unnecessary clinic visits for follow-up care. Drug and alcohol addiction is a major community health concern across our country. Many regions are successfully using MIH practitioners to provide care and support drug overdose victims well beyond responding to the call and providing naloxone or Narcan to restore their breathing and to wake them up after an overdose. These programs partner with substance abuse treatment facilities to provide ongoing care to overdose survivors and to help them beat their addiction and prevent further relapse. EMS systems that provide MIH care have decreased the number of non-fatal injury, illness, and disability, which is also called morbidity, as well as mortality or death rates in their service areas. Many emergency departments and urgent care facilities recognize the value of employing EMTs and paramedics as technicians in their facilities. EMTs and paramedics can operate within their respective scopes of practice to evaluate, monitor, and provide care in emergency department and urgent care settings. Some emergency departments will utilize paramedics to initially evaluate and triage patients as they arrive in the facility to prioritize them for care. In the image here, we see an emergency department paramedic caring for a patient while radiology and respiratory therapy staff stand by to assist. Industrial facilities that utilize dangerous machinery, hazardous materials, or have a high-risk work environment may employ EMS providers as part of their occupational medicine program. These individuals can provide safety inspections, routine medical screenings, physical exams, and urgent care for minor workplace injuries. Industrial EMS providers will also respond to medical calls and traumatic injuries throughout the facility. Industrial EMS providers may also be cross-trained to perform high-angle rescue operations, hazardous materials response, and/or fire suppression as part of the workplace emergency response team. Tactical medicine is a specialized EMS field that focuses on providing medical support in high-risk and often hostile environments. It integrates principles from both emergency medicine and tactical operations. Tactical EMS providers are trained to manage acute injuries and medical conditions that occur in the context of law enforcement and other high-stakes tactical operations. Tactical medicine emphasizes rapid assessment, immediate on-site intervention, and efficient evacuation to higher levels of care. Interventions include skills such as hemorrhage control, airway management, and trauma care. Tactical EMS providers, sometimes called SWAT medics, train alongside law enforcement teams to become proficient in providing immediate care and stabilizing injuries while maintaining their safety and ensuring the safety of the patient and other team members. Tactical providers must be able to perform under pressure and adapt to rapidly changing scenarios. Situational awareness is a vital skill for tactical EMS providers. Some agencies provide the opportunity for their providers to complete additional training and credentialing in areas such as technical rescue, water rescue, and helicopter rescue. Specialization in technical rescue disciplines are dependent upon the agency's location and needs of the communities they serve. This can include confined space rescue, trench collapse rescue, search and rescue, and both high and low angle rope rescue. These areas require significant additional training and require ongoing continuing education training along with hands-on training to ensure continued competence. Each of these areas are low-frequency, high-risk situations where technical skills and expertise are key to a positive outcome. Water rescue is another special operations skill set that agencies may cross-train their EMS providers to perform. Water rescue can include swift water and flood rescue, as well as deep water or dive rescue. As with technical rescue, initial and ongoing training and skill practice is necessary to maintain proficiency. Lastly, EMS agencies may collaborate with law enforcement and fire rescue agencies to provide training in helicopter rescue and medical evacuation. This is extremely helpful in areas with limited egress and unique terrain. Event medicine is a specialized branch of pre-hospital medicine that provides medical support at large events such as concerts, sporting events, and festivals. Event medicine providers are strategically deployed to be able to respond quickly to assess, manage, and transport event goers who experience a medical or traumatic emergency. Event medicine providers may be deployed on foot, bicycles, golf carts, and other utility vehicles or UTVs. At sporting events, providers may be deployed on the sidelines of the playing field to respond to emergencies involving players, while additional providers are available in the stands to handle emergencies involving guests. In the image here, an NFL player is treated after collapsing on the field due to a cardiac arrest from a tackle to the chest. Event medicine requires a great deal of planning and coordination to ensure adequate response capabilities and egress through large crowds and potentially dangerous situations. While 911 EMS systems primarily provide emergency response and transport to the closest appropriate facility, interfacility transport, or IFT, involves non-emergent transport of patients between healthcare facilities. This may include transporting patients from a nursing home to a healthcare facility and returning them once their visit is complete. Transportation to specialty care facilities for dialysis, diabetes care, cancer chemotherapy treatments, and other medical treatments would likely be completed by an interfacility transport team. Most of these transports are low acuity and are often handled at the basic life support level. Critical care transport, or CCT, refers to the specialized and coordinated movement of high acuity patients from one medical facility to another that is better equipped to care for them. Critical care transport teams usually consist of an EMT and paramedic, but may also involve a nurse, respiratory therapist, and/or physician or other advanced practitioner. The process may involve the use of advanced medical equipment, including IV infusion pumps, a ventilator, or a cardiac balloon pump. The goal of critical care transport is to ensure the continuous monitoring and management of the patient's condition during transport, which may include interventions such as mechanical ventilation, administration of medications, and other advanced life support care. This service is essential for patients requiring urgent access to higher levels of care, specialized treatments, or surgical interventions that are not available at the originating facility. Critical care transport services are often provided by specialty care hospitals, such as children's hospitals, neonatal intensive care units, burn centers, trauma centers, and cardiovascular care facilities. In the image here, we see a pediatric critical care transport unit from the Akron Children's Hospital in Ohio. Medical evacuation or medevac helicopters were first used in the Korean War to transport injured war victims to mobile Army surgical hospitals for trauma care. Here in the United States, the first civilian-based medevac helicopters began operation in 1969 as experimental programs in both Mississippi and Texas. Due to the success of these programs, services quickly began to appear in other states across the country. Also called rotor wing aircraft, helicopters provide faster transport and can provide coverage to a broader area, which can be particularly useful in rural settings. Flight crews generally consist of a pilot and 2 advanced life support providers who are usually a flight paramedic and a flight nurse. Helicopter flight medicine crews may be requested by ground EMS providers to the scene of an emergency to transport a patient in need of specialty trauma or medical care that is not available locally. Scene response may also be requested to provide care such as blood transfusion that is not otherwise available by ground EMS units. Medevac crews may also be called to provide interfacility critical care transport of patients requiring a higher level of care than what is available at the facility they are being transferred from. Fixed-wing aircraft, such as airplanes and jets, may be used to transport nationally and internationally and are equipped with specialized equipment including cardiac monitors, ventilators, IV infusion pumps, and intra-aortic balloon pump capabilities. Some aircraft are equipped to provide extracorporeal membrane oxygenation, or ECMO care, which is a machine that takes over heart and lung function when a patient's organs don't work on their own. Flight paramedics are an integral part of fixed-wing flight programs across the country. The International Board of Specialty Certifications, or IBSC, is a globally recognized organization dedicated to certifying paramedics and other healthcare providers in various specialty areas. Their mission is to improve the quality of the care delivered by paramedics and other healthcare professionals functioning in a specialty environment by measuring and validating their knowledge and skills. This is accomplished by providing specialty certification exams that are an objective, fair, and honest validation of a unique domain of knowledge. Some of the areas they offer specialty certification include flight paramedic, critical care paramedic, community paramedic, wilderness paramedic, tactical paramedic, and tactical responder. Specialty care credentialing ensures providers meet rigorous standards of competency and are prepared to deliver high-quality care in their respective fields. By maintaining these certifications, healthcare providers demonstrate their commitment to continued education and excellence in specialty practice. This brings us to the end of this presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, please consider going back to review any content that you struggled with. Thank you for watching this learning module.